Good morning to all. I, Dr. Rimjin Ray, Head of the Department of Psychology, Asutosh College, welcome you all. Welcome my fellow colleague, today's speaker, Dr. MoonMoon Dutta, and my all teaching and non-teaching staffs. Today we are observing the World Mental Health Day. Before we start, I would like to extend my thanks to our respected Vice Principal Sir, Dr. Apurva Roy, our respected Bar Sir, Dr. Manush Kobe, respected TIC, Dr. Reena Kaur Dr. Madam, and our Honorable GB member, Dr. Shayani Mukherjee Madam. I must mention my deep sense of appreciation to Dr. Sriparna Dr. Roy Madam, IQAC Coordinator, Ashutosh College, for her gracious presence. Welcome you, ma'am. And now I would request to Sriparna Madam for saying few words. Over to you, ma'am.
Thank you, Rimjin. Thank you so much. Good morning, everyone. A very warm welcome from the IQAC of Asutosh College. We have amongst us today Dr. MoonMoon Dutta, Assistant Professor and Head, Department of Psychology, Gokhale Memorial Girls College. Thank you, ma'am, for joining us today. As we are all aware, in the past few years, there has been a gradual increase in the number of discussions related to mental health. When the pandemic had hit us very badly, the most important concern, apart from the physical health, was our mental health. People, due to the national lockdown, were almost caged at home. Many of them were even without work, and this had made the situation even worse. A dramatic rise was witnessed in the number of people going through depression, anxiety, and various other mental illness. While it was a taboo to discuss the issues in the past, people nowadays have become self aware and sensitive towards the mental health. This has changed things for the better. It is true that we have come a long way, but there's still so much more that needs to be done to ensure that people with depression, anxiety, or any other mental illness do not find it difficult to fit into the society. The World Mental Health Day dates back in the early 90s when the World Federation of Mental Health officially established the World Mental Health Day, and since then it has been observed every year on 10th October. This day is celebrated to challenge the various issues faced by those suffering from the disease as they fear social stigma and the lack of understanding. The day is celebrated to mark the need for advanced awareness and treatment of mental illness. The World Mental Health Day theme for 2022 is Mental Health in an Unequal World. It has been officially announced by the World Federation of Mental Health. With these few words, may I now request the organizers to kindly proceed with today's program. I hope today's deliberation shall enlighten us further on this important and pertinent issue of mental health. I wish the event a grand success and thank you once again, the head of the Department of Psychology, Ashutosh College, for inviting me to today's program. Thank you so much. Over to you, Rimjin.
Thank you so very much, ma'am. Thank you so much for your participation, active participation. And now I would request Noirita to introduce today's speaker, Dr. MoonMoon Dutta, Assistant Professor and Head, Department of Psychology, Gokhale Memorial Girls College. Over to you, Noirita.
Thank you, ma'am. Today, I would like to introduce our respected speaker, Dr. MoonMoon Dutta. She is currently working as an assistant professor and head of Gokhale Memorial Girls College. From completing her PhD till date, she has worked in various places and served as a teacher and psychologist. She was posted as a clinical psychologist at RG Corp Medical College. Also worked as counselor under Adolescent Health Clinic at District Hospital, Howrah. She served as a lecturer for psychology in various colleges under CU. Along with it, she worked as a visiting faculty in the PG Diploma in Yoga Therapy, Department of Physical Education, Jadavpur University, from July 2012 to April 2013. And she worked as a guidance and psychological counseling under the Department of Adult Continuing Education, Extension Work and Field Outreach, Rabindra Bharati University from August 2014 to March 2015. Currently, she is a practicing clinical psychologist and an assistant professor. She had numerous publications and researches, and she had few research interested include ADHD, children and adolescents well-being, psychopathology, CBT, improving unconscious dynamics, psychoanalytic perspective, happiness and emotional characteristics of children, marital quality, family pathology, trait anxiety, motherhood, parenting style, personality strengths and weaknesses of children with ADHD using CAT. She also had a Bengali publication, ADHD or Manashik Tripti, Moner Kotha. She was awarded Teachers Fellowship under Faculty Development Program, UGC for PhD work, and also Summer Research Fellowship for Teachers by Indian Academy of Sciences for the research project Chronic Stress-Induced Cognitive Deficits, evaluation by 2 neuropsychiatric animal model, mice and zebrafish. Research was conducted at Epigenetics and Neuropsychiatric Disorders Lab at Hyderabad Center for Cellular and Molecular Biology. She had been participated in various workshops and seminars, among them CBT, hypnosis, experimental and clinical approach, workshop on cognitive retraining in traumatic brain injury, disability, a battle with reality, international conference on developmental disability, and recent approaches in mental health researches being the prominent ones. Today, I would like to Ms. Dr. MoonMoon Dutta to proceed with our today's seminar, and over to you, ma'am.
Thank you, Noelika. And all very, I'm really feeling very honored that you have invited me as a resource person in a very special day today. Thank you all. First, let me know over here there are 7 participants. Any students are there? Because I could see only 7 participants are there. Are there any students? That's I want to know about. Rinjin, কোনো students আছে এখানে?
Students are there, but ওরা join করছে through YouTube.
Okay, students are there. Okay, right. So I would like to first of all I would like to share PT, okay, and then I can start my discussion because I will get hardly half an hour time. I hope the screen is visible.
Yes, ma'am.
Okay. So today, it's a very important day, the World Mental Health Day 2022. Now it's and it is always celebrated in the year in 10th of October, and this day was recognized by the World Health Organization. And every year there is a theme on the basis of which this day is celebrated, because you know that mental health and well-being is a huge domain. So what World Federation of Mental Health decided some themes. Okay, there are main themes each year. For example, in 2018 and 19, there was also a theme on suicide prevention. So there was a theme on how to make mental health as an all-round investment. And for 2022, the theme is on make mental health and well-being for all a global priority. So this is the theme of World Mental Health Day of 2022. Now, if we just look at this theme, then we will get an idea that over here, the emphasis is not given only on the mental health. A new word has been introduced, that is well-being, and not only that, to make a global priority. So over here, the thing is, we are not only we will not discuss about mental disorder or only about mental health. Rather, it is important that we should discuss how we all can enhance our general well-being so that we can have a sense of contentment in our life. Now, let's see. Now, what is the vision of this theme? What is the vision that has been proposed by the World Health Organization? Number one is to promote mental health and well-being, to prevent mental illness. Third, to promote destigmatization, which is a very important thing, especially in our country. And next, providing accessible, affordable, and quality health and social care. So this is the vision that has been kept in mind by framing the theme of this year's how we can celebrate World Mental Health Day. Now, what is mental health? Now, WHO defines mental health, that mental health has taken the position that the World Health Organization has taken the position that mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully. And the thing is, we will not only restrict to the individual perspective, rather to the community perspective as well. So we have to make some contribution to our community as a whole. So this is what we mean by mental health. So mental health includes a state of well-being, so where we are realizing our own abilities, our own potential, so that we can cope up with the normal daily stresses in our life, and so that we can work productively and can contribute to our community. So, a good mental health or resilience is the capability to adapt better than expected in the face of significant adversity or risk. This is what we want to achieve. Now we will come to what we mean by well-being, because these are the two important terms that have been used in this thing. Now the term well-being encompasses all the ways in which people experience and evaluate their lives positively. So it encompasses all the ways in which we experience and evaluate our lives positively. So now the question that comes in our mind, that what does it mean to be well then? So there has been different approaches, there are different ways how we can explain this term well-being. There are many numerous scholars define well-being from different perspectives. Not only those scholars belong to our field, not only the field of psychology, but different scholars defined well-being in a different way. Now, if we all classify, we all group it into two major categories, now we can say that well-being can be defined under two broad perspectives or two broad traditions. One is the hedonic tradition, another is the eudaimonic tradition. So, if we now look at this according to what we mean by hedonic tradition. Now, how does hedonic well-being means? Now, hedonic well-being consists of frequent pleasant feelings. It only deals with happiness. Okay. Means how many frequent pleasant feelings an individual is having. And infrequent unpleasant feelings. And thus an overall judgment that life is satisfying. So it's like a weighing balance. It's too much of pleasant feeling, then yes, life is satisfying. If there is too much of unpleasant feeling, then no, life is not satisfying. So this is hedonic well-being. It's like a subjective well-being that varies from one person to another, depending upon how an individual is experiencing how much the individual is experiencing pleasant feelings in his or her life. Now, another tradition, another group of scholars, they define well-being in a different way. This tradition is called eudaimonic well-being or eudaimonic tradition. Now, according to this perspective, they're saying that there are certain needs or qualities that are essential for one's psychological growth and development. Okay? So, it's not so easy that just by increasing the pleasant feelings, it will give rise to an enhanced well-being. The eudaimonic tradition, they're saying, no, it's not so easy. It's a little bit complicated. Because over here, every individual has certain needs and qualities, and that are essential for one's personal growth and development. And the fulfillment of these needs enable the person to reach their full potential. So when an individual reaches their full potential, then we can say that yes, that individual has enhanced well-being. Yes, at the stage of contentment is reached. This is what eudaimonic approach is saying. Now, over here, since there are many the psychology background students are there, so I would like to mention one name over here that is very pertinent to the eudaimonic well-being concept, that is REEF model. REEF, R-Y-F-F, REEF, 1989 proposed that psychological well-being is an example of eudaimonic well-being. So when we will say that a person is functioning well in life? When we will say? Reef stated that if there are 6 key features are there in the people, then we will say, yes, the person is functioning well in life. Now, what are those 6 features? First, Reef talked about autonomy. Means the individual who is having psychological well-being, the person should have maturity to be guided by internal standard. They should have their own standard. Okay? They should have their internal, that standard should be guided by the internal locus of control, not external. So there should be a sense of autonomy. Second, number 2, positive relationships. Means the individual should have capable of trusting and loving others. So the positive interpersonal relationships. This is the second feature that Reef talked about when discussing about the psychological well-being. The third is self-acceptance. Means the individual should have a positive self-image, a positive attitude towards themselves, a good self-efficacy, good estimation of oneself. Number 4, environmental mastery. Means the person should have the resources to manage external stressors. And 5th, purpose in life. Means the individual should have important aims and goals, and fulfillment of that aims and goals will lead to contentment. And last, 6th, personal growth. That is, we should accept new challenges in life. Why? For furthering their development, for furthering our own development. So these are the 6 key features that Reef 1989 talked about, that should be present in a person when we will say they are functioning well in life, they are having good psychological well-being. So okay, now let's talk a little bit over here. Actually, I would like to know can the students can interact over here? Is that the provision is there? How the students will interact? Is there any provision for that?
Ma'am, we have told them to send their question in our group. We will sort them out at the end of the session.
At the end of the session. Okay. Thank you, Nandini. Okay, so we will move on to the next. Now, this is the global background about the theme of our today's the main theme that has been the way we will celebrate the World Mental Health Day of 2022. Now that it comes to what are the challenges of mental health in India then? What is the picture in India? A study was a very important, a very good study was conducted in India in NIMHANS in Bangalore in 2010, where it was said that almost 12 to 15, the range was like that, percentage of people are suffering from mental disorders in India, irrespective of their age, of their gender. It's quite an alarming figure. So now what are the challenges of mental health? Again, other numerous studies are saying that Indian epidemiological studies are reporting low prevalence rate compared to that of the studies which are done in the Western world. Now, why that? Maybe the number of individuals approaching to the mental health professionals are less. That may be one of the reasons. Other reasons is like, it may be that Indian people, we are very resilient. So we have a less mental illness or mental ill health compared to that of people who are in the Western world. Or maybe there is a huge stigmatization, marginalization, discrimination, lack of awareness and education. Or maybe there are a shortage of mental health, adequate number of mental health professionals. So these are the factors, a reason that have been cited behind why in compared to other countries, why the Indian epidemiological studies are reporting low prevalence rate of mental disorders. So what are the challenges of mental health in India? Number one, stigma related to mental disorder. So this is what I consider. This is the day that I've been invited over here as a speaker to talk about World Mental Health Day. I think that this is a day that gives us the opportunity to talk about mental health issues, to talk about what we can do more regarding mental health issues, so that we can we can make it as a global priority. We can make it a reality. Okay. So this day gives us that opportunity. So one challenge is that mental health in India is combatant, that is stigma related to mental disorders, lack of awareness in common people. Till now, we feel very ashamed of saying I'm suffering from depression or I'm taking medicines because I'm suffering from schizophrenia. Till now, we are not saying we are hesitant. Okay. So lack of awareness in common people, delayed treatment-seeking behavior. So early interventions is not possible, and if early intervention is possible, then the outcome rate would have been far greater. Lack of low-cost diagnostic tests, that is very important. It's very expensive. Treatment for psychiatric illness is very expensive, both for medicinal perspective as well as for the psychotherapeutic perspective. lack of easily available treatment. As I've just mentioned, there is shortage of mental health professionals. So there is a lack of easily, though there are some national programs are still there at the district level, okay, are there at the rural level, urban level, but still there is, if we compare with our population, still there is a lack of easily available treatment of mental health or mental illness. So now finally, now what we can do, okay, what we can do to fight with these challenges. Number one, early childhood interventions. The basic thing, the easiest thing which I feel we can do, we can introduce the subject psychology at the very basic level. Every student at the very basic level, at the school level, every school should have the subject, should have that opportunity to go through the subject. So how they can maintain, how they can get the optimum level of well-being. So early childhood interventions is very, very thing that we should emphasize on. Skills building program. Okay, children's skills building program should be introduced at school level, college level. Socio-economic empowerment of women is required. Why? Because when we see about the prevalence rate of mental disorders, when we consider the gender, then we find that there are a good number of mental disorders where the girls, the women, the prevalence rate is much, much higher compared to that of men. Okay, so that should be taken into account. Social support for elderly people needs to be strengthened. In one study in India where it has been cited that almost 36% of mental disorders are reported in elderly population. So that the social support system that needs to be strengthened. Strengthen the treatment of mental disorders at the level of primary health care. Still, there are some national programs that are still running on, but we need to increase it. We need to provide the treatment of mental disorders at the level of primary health care, okay, so that we can provide early interventions at a very low cost for both the psychological interventions as well as the medicinal interventions. Okay, these are the things that I thought I should share with all of you. So now if you have any, not I will say questions, any discussion, we can discuss. This is the day that gives them an opportunity to discuss with mental health issues. Okay, I think they have only left with a few minutes. I can. If I have that opportunity to discuss on mental health issues, that we can. Is there any questions or any from the student? Because I cannot interact over your student directly. Are there such questions or discussions that they want to do?
No, Dutta, is there any questions or any queries or something like that from students?
Students are yet to write any questions, so we have already requested them to send in their queries and any question they have regarding today's issue. We'll be convening their questions shortly, ma'am.
Okay.
But they don't have to ask questions, because when we use the term question, they become a little bit hesitant. No, they can discuss, they can share, because we have gone through 2 years, we have gone through a very difficult time. Several studies are saying that the different kind of mental disorders, even at adolescence or childhood disorders, have risen remarkably high in these 2 years because of home confinement, because of the national lockdown. So we can share the things. The day, not only we will go for only question answer session. No, this is not like that. I want to discuss. If anyone would like to share their experiences, that is also a nice thing to observe this day.
Questions have started coming in one by one. Like there's one question, some questions are also coming in. So the first one of the first questions that has come in is that how do we understand the symptoms in children, and how does early childhood intervention work?
Okay, that's good. Okay. Now the question. There are 2 parts in the question. One is how to identify the symptoms in children, and the second one is to how we can go for early childhood interventions. Now, first of all, how to identify the first part of the question is very specific. Okay, let's take one disorder. Okay, like say childhood depression. Okay, the depression is also, it's very common in adolescent and adult population, but in children as well, the depression is common. It's not very rare. Okay, but the manifestation is different. Now, in case of children, in case of adult, we can verbalize. We can say, we are not feeling well. Okay, we cannot concentrate. We have problems regarding attention. But in case of children, they will not verbalize it. Okay, they will not verbalize. Rather, we have to question in a different way that for last 2 months, for last 6 months, do you find any change is there in your, or we can ask parents as well in the behavior of a child. If the parents of the child says that my child is very good in studies, but for last 1 month is not concentrating. And for 1 month is saying, I will not go to school. There is a school refusal tendencies is very high. So what I want to emphasize is that in case of children, in case of identifying problems in case of children, we have to main focus on the non-verbal cues, not on the verbal cues only. Okay, so that is very, very important. Again, I will give another example to make it very clear. For example, say a person is suffering from obsessive compulsive disorder. Now, an adult person, an adolescent will come in and the person will say that I'm in distress, I'm using or I am doing this particular behavior repeatedly, and I want to get rid out of it. So you can find that craving that the person wants to get rid out of this distress. But in case of children, you will not find that. Over here, I will take only 1 minute to discuss. A child of say 6, 7 years old. Okay, the main complaint was the child's mother was that my child couldn't complete his work at school. So there can be number of factors. As a professional, you have to explore all the factors that are relevant to the problem. And finally, it was found that the child has a tendency to use eraser excessively. Okay, whatever he writes, he feels that it's not perfect, it's not right. So again, the child erase it, and he again starts from the beginning. So how the child will finish his or her work? So this is again a child and an example of a childhood OCD, where again you have to focus on the behavioral part, not only on the verbal component. The child did not verbalize. I hope I could make it clear the first part of your question. Okay, so what are the symptoms of children? Now, how we can go for early interventions? Number one, awareness of mental illness. Okay, we can aware, psychoeducate parents that these are the problem, these are the thing, and this needs to be treated. Sometimes medicine is also required for intervention, so you have to give it the child. Okay, otherwise, in the long run, other comorbid disorders will complicate the picture. So, the number one is psychoeducation. We have to psychoeducate the parents, the immediate, the primary family members, the main caregiver of the child. Okay, that is the very important thing. And the second early intervention at the community level, if we can talk about at the community level. Over here, teachers plays a very important role. Especially school teachers plays very important role. They can identify, okay, this child is behaving in a different way compared to the other 30 child in this classroom. So that needs to be pointed out. So education, awareness at the level of basic level, that is also important. Then only early intervention is possible. Then only first of all, we have to identify the child that this child is having a problem. Then only the next step will be followed. That is intervention. Okay. I hope I don't know because I cannot communicate with the student too. Okay. May I move on to the next question?
Yes, ma'am. There was another question that often we say that we can go for meditation while we are not feeling well. So keep our mind cool, we go for meditation. So how does meditation actually help with our mental health or to maintain the well-being within us?
Okay. Now, generally, there are three. If we broadly, and if we simplify it, okay, if we broadly say what should be the management, what should be the intervention for any disorder, there are three ways. Number one is pharmacological intervention, medicinal intervention, only medicinal intervention, nothing more than that. Number two, psychological interventions, psychotherapy. There are different forms of psychotherapy. Third is the combined approach, where we combine both the approach, that is medicine plus psychotherapy. Okay. Now that depends upon the nature of complaints of the client or of the patient. And second, depends upon the severity of the problem. So on these two markers, we decide whether we will go only for counseling or psychotherapy or medicine, or we will go for combined approach. Basically, whenever I see in my clinical experience says that whenever I suppose a parent's coming with a child of 10 or 9 years old child, and whenever if I feel that this child needs some medicine, then their parents react. They say, no, it cannot be done without medicine. There are so much of side effects. Then that should be well explained that this is a part of a mental health professional to explain that these are the treatment available for this particular illness, for this particular mental disorder. And these are the side effects which can be tackled easily. But if it is not done, if it is not given at the proper time, then there are associated problems that will complicate the picture, and then we will have no other options. And the treatment will be prolonged. So that we need to educate the parents, especially, or even the person, the adult person also says, okay, I will not take medicine, because whenever I have to take medicine, I have to continue throughout my life. No, it's not that. All mental illness doesn't require prolonged medicine, that you have to take medicine for prolonged period. No, it depends again upon the severity of the problem that you are suffering from. And side effects, every medicine has side effects. So again, there are three approaches. It's not that all the disorders require medicine. No, it can be first. It is always attempted to first to do with psychotherapy, but again depends upon the severity of and the nature of the complaint that the patient is coming with. It will then we will take, and then the decision will be made whether we will go for combined approach or only the medicinal or the psychotherapy. Okay, so if an illness requires medicine, we should take medicine. We should.
Thank you so much, ma'am.
Ma'am, I have a question. Ma'am, my question is that since you were talking about the importance of psychoeducation and the need for awareness, and you said that psychology should be made accessible in schools and it should be introduced, because it's a subject that at the school level, it's not there in a lot of schools, and even at the degree level, it's not there in a lot of colleges as well. So what I was thinking is that should we introduce a mental health curriculum in schools, that not only for people who are just studying psychology as a subject, but because psychology or mental health is a part of everyone's lives, it makes a difference, and not just because even when there is psychology in schools, it is at the higher secondary level and not before that. But mental health is there from early childhood itself, even it starts from birth. So I think this is just my opinion. I'm sharing my views after listening to your.
Absolutely, Rupanjali. I agree with you. Absolutely. Okay.
So
the thing that exactly we should. And what if we can take a topic on mental health at school? That is possible. At least we can introduce the child that along with physical health, we have to take care of our mental health as well. And we can, only by doing 2 or 3 things. Always when I teach my third year students, I always say try to implement the thing that you have learned for these 3 years. Okay, and do 2 or 3 things in daily. Practice it. You can enhance your well-being. So if that is there at the very basic level, so definitely the thing that we have saw in the slides, that the challenges of mental health in India, and it could have been, we could have reduced the burden of mental illness in India. We could have reduced the burden. Yes, Rupanjali, I agree with you. Fully agree with you.
Yes, definitely, ma'am. Because when I was in school, we used to have this thing called value education, which was a part of our compulsory. It was there from when I was in class 1 to the point where I was in class 12. So throughout my school life, it was there. Value education was there, but something as important and as application oriented as mental health, we were not taught that necessary skills, like how to manage your stress, how to identify emotions, how to regulate your emotions in a healthy manner. And I think that's very important for students to learn from a very young age, and particularly because of what has happened in light of the pandemic, which has had a massive impact on mental health. We are only now beginning to see exactly what kind of impacts it had with the recent researches that has been going on for the past 2 years. So if we could look into that side through research or through making policy changes if necessary, through governmental intervention, and basically this would require a sort of coordinated efforts from mental health care professionals, even students, if they have ideas, like students who are pursuing psychology at the undergraduate or postgraduate level, taking inputs from everyone and collaborating it and designing a curriculum that benefits not only the students but also their parents and the educators themselves as well.
Very true. Very true. We need to implement it, because when we talk about psychology, people think that we will talk only about mental illness, mental disorder. No, we will talk about positive psychology. That's why the concept of well-being has been introduced in this year's theme. Because well-being is, when we talk about well-being, it touches every individual. But when we will talk about mental illness, again, we are segregated. Okay, so we have to. Every individual has a right to enhance their own well-being. And see, if we can enhance our well-being, then that will give a sense of happiness, contentment in our life, and so there will be more weightage of positive feelings in our life, and so definitely the prevalence rate of mental illness, it will have an impact on that as well. So yes, we should use. I totally agree what the Rupanjali you shared. It's very important. It's very important.
Yes, ma'am. Thank you, ma'am. And there are a few, one or two more questions. Somebody has said that what is the best way to improve their mental well-being, and are there any topics of conversation they should avoid? I guess when talking about mental health.
Okay. So first thing is, what are the things how we can improve our well-being? Okay. And now know what send the question, which semester?
I think it came from semester 1. Let me just check. It's semester 1.
Semester 1. Because I think in semester 5 we have a practical on well-being in our curriculum. So semester 1 is now it's how we can enhance our well-being. If I say do only 2 or 3 things daily, 2 things, okay, it's very easy. Number 1, introspection. At least just spend 2 to 5 minutes time daily. Just do it only for 2 weeks. See what will happen. Just do it only but you have to be consistent. Huh? You cannot break it. You have to do it consistently for 14 days. Why for 14 days? Because we all know that learning is not only psychological, learning is neurophysiological. So when we are creating new associations or when we are breaking old associations, all are synaptically related, all are neurophysiological. Okay, so we will give 14 days in order to develop that new bond, stimulus response bond.
Ma'am, you are not audible, ma'am.
Find out that what are the things that you have done on that day. You don't have to evaluate, you don't have to analyze. No, nothing you do. Don't do it, all this thing. Just sit at night or at evening, whenever you feel like, and from the morning till evening, what you have done, just try to recall it. And just see, you can recall it or not. Okay, you don't have to analyze it. Oh, I behaved so badly with this particular individual. Oh, I behaved so nicely. No, don't evaluate. Don't analyze. Just recall it. Okay, just do it for 14 days. What does it mean? It means it will increase your state of alertness. Okay, so that is very easy. Just do it one. This is one. And number 2, just start doing it. Just do it on 14 and just give me a feedback on that. Second thing is then acknowledge anyone, just simple praise one, anyone, maybe your family member, okay, or anyone, every day once. একবার শুধু, ঠিক আছে? কাউকে একবার প্রশংসা করো, acknowledge করো. It should not be fake, it should be genuine. Okay, we should develop this habit of praising, acknowledging, develop the habit of gratitude. Okay, this most of us, we are missing it, we are lacking it. We don't say thank you, we don't say sorry. The যতটা frequently বলা উচিত আমাদের. Just দুটো জিনিস করো, do it 2 things only. You don't require so much of strategies. Okay, 2 things. See, you will. These 2 strategies is enough for you for a semester 1 student to enhance your well-being. But the thing is, the criteria is you have to do it consistently without any break for 14 days. Then only it will give a stable, enhanced well-being. Next, any other, Rupanjali? I think we have only 7 minutes left. You know?
Ma'am, there is another question that why in India and other third world countries people are so cowardly to talk about and discuss mental health in public as they talk about any physical complication. Comparing to the West, is it our lack of awareness or is it just ignorance? And what is the remedy for this?
Yes, not only, yes, lack of awareness, definitely. Lack of awareness is there. We cannot ignore it completely, that lack of awareness, there's no lack of awareness. Yes, lack of awareness. Second is the stigmatization. That if I say that I'm suffering from depression or I'm taking psychiatric medicines or I'm going I'm going through a psychology for my session, okay, now that the individual feels that I will be evaluated in a negative way. So if I evaluate it in a negative way, then I will be isolated. Okay. Now, if we go by Maslow's theory, need for affiliation, need for love and belongingness, this is the second statement. The primary is the physiological need, and second is the love and belongingness. So see, there it has been the threatening. The threatening is there, lies. That if people reject me, if I'm an isolated way, তাহলে তো I will be treated in a different way. Okay, so other people will not accept me. So my second order needs, according to Maslow, will not be fulfilled. If my second order need becomes unfulfilled, then how I will climb the stairs of the third, fourth, fifth order need? Because that will going to hamper my self-esteem. Okay. So there's the fear that there will be a rejection. There will be no acceptance. If every one of us, if we are aware of it, that yeah, this is an illness like a physical illness, so this requires different form of management. And if properly managed and taken care of, then it is also manageable. We can get rid of the distress. So if this notion is given, if there from a basic student or basic childhood level, then definitely this fear of evaluation, of this fear of rejection will be reduced, and more there will be acceptance, and more the people will come forward and they will say, yes, today I had a session with my psychologist, my therapist. We are looking forward to this day. Thank you. Thank you. The question that student brought this question.
And
Thank
also, I like to add something. Taken a fear of judgment. I'm being judged. এই ফিয়ারটা অনেক বেশি কাজ করে।
True. একদম খুব ইম্পর্টেন্ট। মানে আমি তো বলবো যে লাস্ট আমরা যখন একদম এন্ডে এসে গেছি আমাদের আজকের টকে, সেখানে লাস্ট খুব ভেরি ইম্পর্টেন্ট কোয়েশ্চেন দ্যাট উই ডিসকাসড, ভেরি ইম্পর্টেন্ট কোয়েশ্চেন। সেখানে জাস্ট বাই আমরা অ্যাওয়ারনেসটা বাড়ালে আমাদের যেটা হবে, আমাদের রিজেকশনটা আমাদের কমবে, ফিয়ার অফ যত বেশি রিজেকশন কমবে, ওকে আই উইল নট বি আইসোলেটেড, তত অ্যাকসেপ্টেন্স বাড়বে, যত অ্যাকসেপ্টেন্স বাড়বে তত আমরা অ্যাপ্রোচ করবো, আমরা অ্যাভয়েড করবো না, তত আমরা বলবো ওপেনলি, ইয়েস আই এম টেকিং মেডিসিন। So yes, awareness is required, education is required regarding mental health. Thank you.
আর কিছু আছে কি? Shall I proceed?
one person has just made an observation. So somebody from first sem said that since I was speaking about the identification of emotions and emotional regulation, so in light of that, first sem student has said that they would like to talk about the identification of positive peers as well. So if they know that the person, if somebody comes to know that the person they are mixing with is positive or negative, they would be able to withdraw from the negative group. This can also amount the impact of negative impact of such peers in a student's life.
Yeah, he talked about the positive peer relationship. Definitely, positive peer relationship, it enhances our self-esteem. We always want to, yes, I think this is only about our observations. Right, Rupanjali?
Yes.
If there is no more question, please, Rupanjali, convey my thanks to the students whom I cannot interact directly.
Yes, ma'am.
15 minutes and the most of the time just to discuss, because this day is an opportunity just to discuss mental health issues, not for any formal presentations.
So our department and I personally am extremely grateful to have a resource person like you, MoonMoon, and your presence and experience give more meaning to it. Thank you once again. And I would like request to Dr. Asen Singh sir for giving official vote of thanks. Over to you, sir.
Okay, ma'am. So, warm and graceful morning to our resource person, Dr. MoonMoon Dutta, ma'am, Assistant Professor and Head of Department of Psychology, Gokhale Memorial Girls College. AR sir, Vice Principal, Asutosh College. MK sir, Bursar, Asutosh College, Internal Quality Assurance Cell, IQAC of Asutosh College, HOD Department of Psychology, Dr. Rimjim Ray ma'am, respected teachers, dear students, and everyone present digitally in this webinar. It is my privilege to propose a vote of thanks and acknowledge the contribution of those who worked hard to make this webinar successful. I, Dr. Asen Singh, on behalf of Department of Psychology, Asutosh College, extend my sincere thanks to today's resource person, Dr. MoonMoon Dutta ma'am, who spared her valuable time with us. Today, we had an opportunity to hear your thoughts, and this will surely encourage us. Your thoughts have enlightened our mind and have shown us a new path in the way of mental health and well-being. Today we have got a lot of information which will truly help us in our life. Thanks to Dr. A.R. sir and MK sir for giving permission and essential support for organizing this webinar. We pay heartful thanks to our HOD, Dr. Rimjim Ray, for her efforts to organize this webinar. I thanks to IQAC and IT cell of Asutosh College for their great support. I also want to extend thanks to all teachers and students of Department of Psychology, Asutosh College, for their cooperation. A big thanks you all who present in this webinar. Have a great day ahead. Thanks again. Thank you. So,
Thank you so
next-
much.
Thank you again. Thank you so much to the organizer. Thank you.
Thank you, ma'am. Thank you.
Thank you so much, ma'am.
Rimjim, আমি লিভ করে যাব? Thank you.
Thank you, ma'am.